Hello everybody, thank you for joining us for today's video. Today we want to talk a little bit about therapy and medication, therapy versus medication, how they work together, how they're opposed, if they are. I think it's a question that I get a lot when I'm doing my very first assessments with people is we'll ask them what meds they're on, and sometimes I get people asking me if I'm going to help them get off of their meds or if I think they should stay on certain meds. And yeah, I just think it's a common question people wonder about. Do you need meds? Do you need therapy? Do you need both? I feel like there's lots of directions we could go with this.
Yeah. Josh, what do you usually tell people initial assessment when they come in and start asking about meds?
Your microphone's backwards.
Like,
I'll edit this out, or I'll leave it in.
I was like, that looks so funny. Okay, that makes more sense. I was like, what the heck? Okay, sorry. What was your question again? What do I do in initial assessment with meds?
Yeah, when somebody asks you about meds, what do you say?
I'm a believer in them. I think that they're helpful. I would say when it comes to mental health, I actually think meds are very helpful, but I think my experience has been very much people don't want to become dependent on a medication. And so over the years in working with folks, I've come to the conclusion if I can help you manage whatever you're experiencing without it, I'm down to try that, but I very much think meds have their role in that. If that's something that the client's open to. Is that a good answer? Does that make sense?
Sure, yeah, I think it
think
makes
so.
sense.
Yeah.
I think it's interesting because I actually think all therapists handle this really differently. I think everybody kind of has their own take on medication management. Sometimes we have people who come into therapy for their initial assessment and they think that we are going to prescribe them medication, right? So therapists don't prescribe medication unless they happen to be a medication prescriber. So, they're not like a master's level therapist. They have to have more schooling, more training than that. So
like a psychiatrist.
Like a psychiatrist. And so if you come into a therapist, you're not going to be able to get meds from us. Like we can't give you any kind of medication, any kind of prescription, anything like that. And as far as like a recommendation, we're even not going to make a recommendation about a specific medication. Instead, we might say, hey, I think you should go talk to somebody for medication management. Either go see your primary care doctor or go see a psychiatrist, something like that, right?
It's important to keep in mind, and I've had experiences where I've had my hand slapped because of this. It's outside our scope of practice. And so regardless of what our own opinions are, we really probably shouldn't be commenting on it, other than, hey, it may be helpful for you to go see somebody. And then as a therapist, I also think it's important for us to be at least mildly aware of what some of the side effects of these are, so that we can be like, hey, you may want to go see your prescriber.
Right. I think that's totally true. So Josh is saying first session, you're seeing what kind of medications people are on, and then you're kind of leaving it up to them. Hey, if you want to try to go at this with just therapy for a little bit, I'm totally down with that, but also I'm supportive of you doing a medication evaluation.
And I would say that specific statement is usually if people are coming in and they are not taking a medication. I don't ever try and tell them, well, let's come off of them and try this without. Usually that's if they come in and for example, my anxiety is really, really high, but I don't want to be dependent on a med. I feel like I see that regularly. I'll say, okay, well, let's give it a few weeks, see if what we can do here is helpful, and then we'll revisit the med topic. So I would say that's probably my response if people are not currently on medication.
That's fair.
I feel like the most common conversation I have around this is people asking me, can I get off of my meds, if I do enough therapy, or is this something I can not need anymore? And I don't know how you guys respond to those kind of questions, but typically I just go with if you want to work on getting off of your meds, that's something to talk to your doctor about, and I can support you and help you figure that out along the way, but it's not for me to push you one way or the other. And same goes the other way, right? If someone says, I really don't want meds, I'm not going to be the one to push them to do that either. It's okay, then let's try it.
Right.
Just this way.
Yeah. So, really, it's just outside the scope of our practice to be able to make any kind of recommendations about medication other than, hey, maybe you should go see your psychiatrist or go see your doctor and talk to them about meds. Yeah. Right. I feel like a lot of times people come in for their initial assessment and the thing they ask me is, do you think I should go get a medication appointment? And in all honesty, I often tell people like, hey, look, sometimes I think it's a good thing to start one thing at a time so that you know what's working. Because if you start therapy and medication at the same time, and sometimes that is the best option. I'm not saying that's never the best option. But if you start a whole bunch of things at the same time, it can be hard to know what's working and what's not. As opposed to if you give something a try for a little bit and then add something, then you will be able to tell a little bit more about what's actually helping, right?
Mm-hmm.
Yeah, I like that.
I remember reading a study. This is just a side note. This was a long time ago, and I did not review it for this episode, right? But they were measuring the effectiveness of medication management versus therapy in the recovery of depression. And then they combined the two. And it was like therapy was this effective, meds were this effective, and the combination was even more so. But I like the idea of, again, if they're not already on meds, and do I go see an evaluation or do an evaluation? I like the idea of knowing which one is having the biggest impact.
Instead of starting with everything.
Mm-hmm.
Yeah.
And in regards to what you said earlier, I've actually had a few clients who are like, I want to come off of my medication,
Mm-hmm.
which is not uncommon. This is my own personal anxiety. I don't ever want to know that you're doing that if your doctor doesn't know that. So I'm always like, tell your doctor, but okay, let's do this. Right?
Right.
And I'll support you with
Do it the right way.
Uh-huh. I'm curious what your guys' experience has been with medication adherence in treatment.
So medication adherence meaning like, are people taking their medications as prescribed?
Yes, which means twice a day, 3 times a day, as needed, like whatever the doctor says. Like, how much do we actually adhere as human beings to what the actual prescription is? What's your experience been?
I don't hear great things along these lines. One of the things that I feel like I run into a lot as a therapist is that my client will have already been on medication, come in and we'll start working through some things in therapy, and they start to say, hey, I felt great, so I just decided to stop taking my antidepressant.
Yeah.
Right? We hear this a ton. And what people don't understand is that the withdrawal from an antidepressant can give you the most horrendous depression symptoms. And so over the next couple of weeks, you're going to feel terrible. Like, you might feel okay for a couple of days, maybe even up to a week, until some of that starts getting out of your system. And then you can have this complete opposite effect where you just feel awful for quite a while. And so then people are thinking, oh my gosh, no, my depression is back, and I can't get off my medication. And which isn't always even true. It's just that you have to come down off your medication. You got to do what your doctor says to do when you're coming down off a medication like this. So I think that's one of the ways that I see adherence to medication being a problem.
Mm-hmm.
Yeah, and when I'm working with someone who does want to get off their medication, that's like the extent of my intervention, is like checking in, like, hey, how are you feeling now that you're on this lower dosage or whatever, right? Hoping that they're actually adhering to what their doctor is telling them to do. But I'm not going to be the one telling them how to wean off of their medication.
Sure.
But to answer your question, I run into it a lot where, like, I'll do an intake and someone will say, okay, I'm going to start. But also, I just went and saw a doctor and I'm going to start this new medication as well. And then I'll talk to them like the next week and they're like, yeah, well, it really didn't help, so I don't know if it's worth sticking or like staying on. And I'm like, okay, well, maybe we need to try it for more than a week, right? Maybe we need to give it like the actual amount of time. I don't know, certain medications take longer to build up and be effective, but I see a lot of that type of adherence where it's not even, they're inconsistent taking it, they just don't take it for long enough to be effective and then kind of discount it right away.
Right. Especially, because like, especially with maybe like antidepressants, that's probably the thing that we see people taking most frequently, I think. And that's one of those medications that, like, if you take it for a couple of days, you're going to get all kinds of side effects, but you're not going to get any of the help, right? And so if you're thinking about taking a medication, it's really important to talk to your doctor about how long should I be taking this before I'm going to know if it's going to work. Because for most people, they don't know within a day or even a week if it's going to be something that's going to help.
Yeah. And I think what we're saying right now is probably exactly what we should be saying in therapy. We know just enough that, generally speaking, an antidepressant requires 4 to 6 weeks in your system. We might know that if you just stop taking your antidepressant, you're going to have some withdrawal symptoms. And so this
you might know that, but you're a lot smarter than I am.
No, I've actually just had some clients with some very specific antidepressants that I'm like, ugh, I don't ever want a client to take that one again. Now, I wouldn't say that, though, because that's outside my scope of practice, right? So I think we need to know a little bit, but I think medication absolutely has its role in treatment. I truly do.
I always, whenever clients ask me about what I think about if they should be on meds or if they should be doing meds and therapy or whatever, I always tell them, like, what matters is that if you're going to do just meds or just therapy or both, like, you just have to be consistent, right? Speaking to adherence, speaking to coming to therapy, right? Both of these things require a lot of consistency.
Yeah, I think maybe as I think about it, this is piggybacking off a statement you made just a little bit ago. My biggest intervention for medication adherence is pull out your phone, let's set an alarm for 8 p.m. so that when it goes off, you know to take your med.
Yeah.
Like, that's really the extent that we get into this.
Or if you're not going to take your med consistently, don't. Like, consistently not. Like, don't just take it, like, 3 times a week and then, hope it works for you. If you're supposed to be taking it 7 days a week.
Right. Take it as prescribed.
Yeah.
Right?
Or don't take it.
I would also say that, like, therapy is the same thing. Sometimes people think that they could come in for therapy and you come once this month and you come twice next month. And I would say that's the same thing as, like, taking a medication not as it's prescribed, right? Mm-hmm. You're not going to be able to get the maximum benefits of therapy unless you're following through with whatever the prescription is, right? Because there are people that I'll tell them, look, I need to see you weekly. There are other people I'll say, hey, look, every other week is going to be good for you. And then there are people who are on a maintenance schedule that come every 4 to 6 weeks. And I would say if you're coming to therapy every 4 to 6 weeks, you're probably not going to make a ton of progress in therapy. You are maintaining where you're at. Right? Yeah. And so both therapy and medication, there's a prescription, and you got to do it like as it's prescribed if you want to get the maximum benefit.
Yeah, I like that.
And I think the hard part, that's why I brought up this idea of adherence. Man, half of us can't remember what we had for lunch today. So it's hard to remember to take meds, and that's okay. That doesn't mean that there's anything wrong, but if we can improve that consistency, whether it's treatment, homework that therapists give you, do the homework, right? All of these things are big factors and they play in. I think medication absolutely has a play. Can I also just note, if it's a medication for depression or anxiety, to some degree there's a level of like buckle up and hold on trial and error that happens.
Sure. There's
a lot of antidepressants out there, and if it takes 4 to 6 weeks, doctors may have to give it 3 or 4 weeks and then make an adjustment, and it can be kind of a disheartening process.
Yeah.
So hold on.
Hold on, keep trying, right?
Stay consistent.
Yeah.
And then obviously talk with your doctor about whether you need to increase dose or back off, or should I change medication altogether? That's a great doctor question. So.
Perfect.
Hopefully that's helpful.
Yeah.
I learned a lot. Meds are not my expertise. Thank you everybody for joining us for today's video. If you enjoyed it, please like and subscribe, and leave any questions in the comments. We'd love to hear from you or talk about whatever would be interesting for you guys. So we'll see you on the next video.
Thanks.
Have a good one.